Stomach rumbling or growling noises, or in medical terms, what we call as borborygmi. Is it normal? Well, let me tell you a story. I had a 28-year-old patient who is an IT professional. Part of his job involved attending various meetings in person with his colleagues as well as meeting clients. One of the problems he was facing whilst he was sat in these long meetings was that his stomach was making a lot of noises, and this was causing him a lot of distraction, and he was starting to get slowly worked up and worried about it, because people in the meeting, they started to look at him seeing if there was something wrong with him. So this started to kind of make him more and more paranoid, and it was also kind of causing him embarrassment, and he started to kind of stop socializing. So this started to get worse gradually, and he had consulted various people without any solution. He decided that enough is enough, and he ended up quitting the job, which he did really like. He is not alone. There is a lot of young people, including the teenagers, who face this problem day in, day out. So, is this normal? Is there anything that in their lifestyles that can be modified? Is there anything that they can do to fix this problem? You'll find answers to all these questions in this video. So the noises that come from our stomach or from our abdomen, why do they occur? Food, water and gas that is going through the stomach, the small intestine and large intestine produce these noises. That's because our gut muscles are squeezing and relaxing, what we call in the medical terms as peristalsis. So it's a process of pushing things forward, and this noises are part of our normal digestion, and it happens in everyone. So when does it become a problem? It's a problem if you're noticing that these noises from your stomach is getting more frequent, it's increasingly loud, or if it is interfering with your work or with your social life, then we need to see, are there other reasons for this? One of the common problems is irritable bowel syndrome, or IBS, where you can do every test and it can turn out to be normal. And this is a stress-related gut disorder. So anxiety, depression, poor sleep pattern, and various causes of stress can trigger this condition, and these noises can be part of this. There is inflammatory bowel disease, where there is significant inflammatory process that is affecting the gut. So there is swelling in the lining of the small intestine and large intestine. There can be ulcers, there can be redness. So the individual can have other associated symptoms like abdominal pains, frequent loose motions, or passing blood in the stool, or losing weight. One of the common problems nowadays we are seeing in medical gastroenterology practice is food intolerances, especially lactose intolerance, which is in dairy products. You could be also intolerant or sensitive to gluten. Gluten is a protein that is present predominantly in wheat, but it's also present in various other whole grains. So there can be food allergies that might be contributing. There is a condition called small intestinal bacterial overgrowth, or SIBO. So generally we have higher concentrations of bacteria in our large intestine, but when there is a backflow of this bacteria into the small intestine and there is excess of this bacteria in the small intestine where it shouldn't be, this can produce a variety of symptoms, including a noisy abdomen, excess amount of gas. You might be consuming foods that are highly gas producing. For example, broccoli, cabbage, cauliflower, lentils, rajma, and also people who consume more milk products. There can be a genuine blockage in the intestines. There can be narrowing in the small intestine or in the large intestine where food and liquid is not able to get through properly, and you start to increasingly notice other symptoms along with these loud abdominal sounds. So there are medical reasons, and there can be dietary factors, and there can be stress-related factors which can influence these noises coming from our stomach. There are a few tips that I would like to share to see if this will reduce these excessive noises coming from the stomach. Firstly, try to eat food on time. Being hungry doesn't create these noises, but it can increase the chances of getting these noisy or gurgling sounds from our abdomen. Having food helps calm down these intestinal contractions and also can help mask the noises that is generating inside the intestines. Chewing the food properly, so eating slowly, can give chance for your food in the mouth to mix with the saliva, and a properly chewed food is better for our digestive system. And also people who eat food very quickly or talking during eating can also swallow or gulp more air into the stomach and into the intestines. And this can also increase the chances of these noises. Reducing the foods which I mentioned earlier on, such as if your food is very rich in lentils, rajma, chickpeas, so cut it down. And also certain vegetables like cabbage, cauliflower, Brussels sprouts, these kind of vegetables, and also fruits that have got high amount of sugar can also be a contributory factor. Cut out the sodas, carbonated drinks, because when they enter the stomach, they release carbon dioxide gas, and this gas has to get through our digestive system, which can again increase the noises from our stomach. Reduce the amount of sugar intake, and also cut out the artificial sweeteners, because they have sorbitol, which can also contribute to these excess noises coming from our intestines. One of the good things to do is to help the digestive system by having regular walk, especially if you can do at least a 10-15 minute gentle walk after eating. This can have a positive effect on the digestive system and can reduce these loud noises being generated from the abdomen. Finally, drinking adequate amount of water. And this is one of the important things for our digestive system. So at least 3 liters, and now that it is summer, probably more than 3 liters would be beneficial. So try and follow these simple tips to see if this will have an impact on reducing these noises that is being generated in the abdomen. When do you need to consult a specialist, a medical gastroenterologist? If your abdominal noises or stomach sounds, if it is associated with a change in your bowel habit, if you have persistent loose motions, or if you're getting increasingly constipated, you should seek advice. If you're getting frequent abdominal pains along with these abdominal noises, then you should take medical advice. If you're noticing that your abdomen is getting visibly distended, and if it is persisting, then you should take it seriously. If your symptoms of this abdominal grumbling, growling noises, if it is persistent, or if it is getting more and more, and if it is starting to interfere with your day-to-day life, you should take medical advice. And finally, if this symptom is associated with a change in your general well-being, or if you feel that your general health is going downhill, then you need to seek advice from medical gastroenterologist.